Hi, this is the first of a series of talks I will be doing on how African nurses can transition their nursing practice to the practice in developed countries. My name is Oluchi. My background is 16 years of nursing practice, 12 years in Nigeria and 4 years in the United States. Everything I'm going to be saying will, of course, flow from this background. Nevertheless, nurses from other African countries, Ghana, Kenya, can also benefit from this because of the similarity in practice between Nigeria and these other African countries. Also, nurses that are planning to practice in the UK, Canada, or other developed countries can benefit from this because the nursing practice in the US is not far removed from nursing practice in these other developed countries. There is a huge gap in practice between developed countries and developing countries. Therefore, there is a lot to learn. There is a lot of adjustments to make. There is a lot of skills to learn because of the difference in technology and all that. So one has to be patient with himself or herself. Take one step at a time so you don't get overwhelmed. Before you know it, you will grow into the process and you will be able to practice as an independent professional. There are two big factors that will prepare you to transition in practice. Number one is the NCLEX RN exam. That's the licensure exam for nurses. Number two is the employer orientation. That's the orientation you will do when you start working. The NCLEX is very important because it introduces you to the scope of practice. Everything or basic things that you need to know are contained in the exam. And there you will be introduced to the similarities and the differences. So because of this, I urge you to take the exam seriously. Study to know, not just to pass. Because when you study to know, it will be easier for you to practice as an independent professional. Rather than just memorizing, how you study to pass, study to know. That's what I'm trying to say. Then the second factor, which is the orientation, essentially what happens there is that you are paired with a preceptor. A preceptor is like a clinical instructor, a nurse, of course, who works in the same unit where you are going to work. So this nurse, you will follow him or her. You will see what they do. You will see how they do what they do, and you will see why. So the orientation for international nurses is about 12 weeks. You can ask for more time after the 12 weeks if you feel like you are not as comfortable as you should be working alone. Also, the preceptor can recommend that you don't last up to those 12 weeks if they feel like you are ready to practice on your own. And the preceptor can also recommend an additional time if they feel like you need more time. So there is ample time for you to learn the basics. But no matter how long you take, it's not going to be enough to cover everything because there is a lot to learn. There is a difference in policies in different hospitals, and then there is technology is always updating, so new things keep coming up. So essentially what I'm trying to say is that you have to be patient with yourself. Learn the basics and then go from there. Learn all you can and then go from there. One step at a time. Even when you start working as a nurse, still you still have to learn new things every time. So it is a growth process. It is a learning process. So having established that these two factors are very important, that's the NCLEX and then the orientation, I would like to point out that there are still some sports that are not covered by these two important factors. And these sports are only obvious to somebody who has practiced on both sides, the developed countries and the developing country. So it is this gap that I want to fill with this series of talk, and I hope that I help. Thank you for listening. Be sure to like, share, and follow for more.